Welcome, everyone. It's wonderful to see everyone on screen, and welcome to the Lifespan Respite Grantee and Partner Learning Symposium. For those of you who are new to our network, I'm Jill Kagan, Director of the ARCH National Respite Network and Resource Center. ARCH is very privileged to house the ACL-funded Lifespan Respite Technical Assistance and Resource Center that organized this event for you this week. Again, for those of you who are new, we do hold this event annually and usually in person and in conjunction with the National Lifespan Respite Conference. And we so look forward to these events every year. But as you know, because of the pandemic, we've had to hold them virtually for the last 2 years. While we really miss being in person again this year, but I know many of us are still riding high from the virtual international short break conference that we held only 3 short weeks ago. I know that I think I can speak for everyone here at ARCH that we were really rejuvenated and inspired by everything that we learned from our respite colleagues around the globe, and I hope that you were as well. I never really got a chance to thank those of you Lifespan Respite Grantees and Coalition partners who presented during the Lifespan Respite track at the conference. It was really wonderful to have that opportunity to hear from you in more depth about your Lifespan Respite and Coalition activities. And I just wanted you to know, for those of you who registered for the conference, and you should have received an email from the conference organizers, you can still access those recordings of those sessions with your original conference login information. And for those of you who weren't able to attend that conference and didn't register, please know that after July 23rd, we will be posting all of the Lifespan Respite track and the ARCH staff presentations and a couple of other relevant presentations for our network on the ARCH website so that they're accessible to everyone. And I'll send out an email when those are posted. Next slide, please. Just a very few quick housekeeping tasks. I know that most of you, if not all of you, are quite familiar with Zoom. We do request that you keep yourself muted when you're not speaking. If you find that your internet bandwidth is limited, it does help to turn off your camera, although we'd love to see you as much as possible. We will have open mic time for Q&A and for small group discussions. But please feel free to post a question or a comment in the chat at any time, and we'll do our best to respond to that or get to it at some point. If you get disconnected, please just log back in with the link you received in your confirmation email. If you're still having trouble, we're so fortunate, and I want to introduce you to Marcia O'Malley, that we have her with us for the next 2 days. And Marcia, if you're there, you can wave. She's going to be assisting us with any technical difficulties, and you can send her a chat message or text her at the number on the screen. And you might want to jot down that number in case you get disconnected and can't find your way back in. Please only text to Marcia, no phone calls. And thank you again, Marcia. We really appreciate your help. Next slide. We're really eager to see everyone who is here with us today and to hear from you. So please say hello in the chat. Let us know what state you're from, and then respond to this question, and let us know what you hope to get out of the Learning Symposium over the next 2 days. And we will do our best to meet your needs and requests. I'll leave that up for 1 second so you can type a little bit. That's, again, please let us know your state and what you hope to get out of the Learning Symposium. Next slide. I am very happy and honored to introduce the amazing ARCH team. They provide the experience and the passion that help us at ARCH provide the training and technical assistance that you need. I have listed on this slide the primary areas that each of them cover. But I want you to know that we do function as a very strong, unified team. And they all have the expertise to work across subject matter and to support each other in providing training and TA in these multiple but often strongly overlapping areas. First of all, let me introduce Cassandra Furman, who heads up our work on performance measurement and evaluation. Feel free to say a few words, Cassandra.
Hi, I'll be brief. I've been with Arch for over 21 years now. I'm fully charged and more committed to respite than ever. Looking forward to hearing from everyone.
Thank you, Cassandra. Susan Summers, who heads up our work in sustainability and in innovative and exemplary respite services and many other areas. Susan?
Good morning, everyone from Seattle. So one of the jobs I do for Arch is to brag and print about all your work. So I'm really thrilled to hear your bring, brag, and borrows. Every year of the past 5 years I've been with Arch, you're all stronger. So wonderful work. Keep it up. Can't wait to hear it.
Thank you, Susan. And Ray Kirk, who heads up Arch's multifaceted respite research initiative. Ray?
Thank you, Jill. Hello, everyone, and welcome to the meeting. My primary role is to work with Jill and programs around the country to try to establish an evidence base for respite as a service and to support the administrative data collection relating to the needs of all of the members and of the respite community. So it's my pleasure to work with all of you and with the rest of our team here.
Thank you all. And again, I'm so grateful to have them working with us here at Arch. And I hope you'll take advantage of their expertise. The next slide, please. Now for our exciting agenda. I'll just quickly go over this. You should have received multiple copies of the agenda. It's also posted on the link at the bottom of the screen, as are all the PowerPoints and other materials related to the meeting. And we'll be posting that link. It's already been posted in the chat, so thank you, Marcia. And we'll be starting off this morning with some welcoming remarks. Very excited about this from Allison Barkov, the Acting Administrator and Assistant Secretary for Aging at ACL. Followed by our esteemed federal project officers, Lori Stahlbaum and Sarah Vogler at ACL. We're always excited to hear what they have to share with us, the latest from ACL. Then we'll move into our long-awaited Bring, Brag, and Borrow session, and I'll repeat the instructions for that when we get to that session at 1:15. That'll be followed by 15 minutes of an opportunity to ask your colleagues questions about what they presented during the Bring, Brag, and Borrow, or to share a comment that you'd love to share. That will be an open mic time, and we encourage you to unmute yourselves and ask some questions. And that'll be followed by a self-care break. And we do have that break scheduled at 2:30 Eastern, but please feel free to take a break whenever you need to. We know that it's not so easy to sit in front of a computer screen for 3.5 hours. And that really is the beauty of a virtual event, that you can get up and move around whenever you need to. But don't stay away too long, because we would really hate for you to miss a moment of the agenda. And we're really excited this year that we added some small group networking discussions in the afternoon to give you more of an opportunity to network with each other and share things that you've been doing and what you're going to be planning to do in the coming year. So it'll give us a chance to talk about the future of respite in this post-pandemic world that we will find ourselves in. And then return back to the main room for a report back and a wrap up of day one. Does anyone have any questions about the agenda? We have a few minutes to respond to those. Do any of my Arch staff see any questions or comments in the chat that we can respond to? Okay, I don't see any.
I don't see questions, but I see a lot of, I'm really agreeing with many of the comments. What has been successful in your program innovations, and how are people measuring the return of investment in respite? That particularly is of interest to me. So,
Okay, great. So we've got some suggestions already about what they're hoping to get out of the next 2 days. Thank you all for sharing that information. Okay, without further ado, I am very excited to introduce our welcoming speaker today, Allison Barkov, the acting administrator and assistant secretary for aging at the Administration for Community Living. In this capacity, she provides executive direction, leadership, guidance, and coordination for ACL programs nationwide, and advises the HHS Secretary on issues affecting individuals with disabilities and older adults. Ms. Barkov comes to ACL from the Center for Public Representation, where she served as Director of Advocacy. And in that position, she led stellar policy advocacy with federal agencies and Congress, and legal advocacy nationally to advance community living and inclusion, including in the areas of healthcare, Medicaid, home and community-based services, employment, housing, and education. I personally have been a longtime admirer of Allison, having had the very good fortune and privilege of following her lead through the consortium with Citizens for Disabilities, and also when she served as Director of Advocacy at the Bazelon Center for Mental Health Law. I've witnessed firsthand her unsurpassed skills as an advocate for people with disabilities, older adults and their caregivers, as well as her extensive knowledge of the federal programs designed to serve them. You can read more about her impressive career path and her bio that's posted on the Arch website and that we shared with you previously. And I'm really honored to welcome you, Allison, to provide some welcome remarks. So thank you so much for being with us today. It's a real honor.
Thank you, Jill, and thank you so much for that really, really kind introduction. And of course, it's been a privilege to work alongside you for so long, and I'm excited to be in this new role. Thank you, Jill, for inviting me to speak today, and for all of the great things that you and everybody who's participating from the network have been doing to support America's caregivers. I was privileged to join the Administration for Community Living on Inauguration Day as the Principal Deputy Administrator. And as Jill mentioned, I'm currently serving as the acting administrator. And I really come to this job bringing a lifelong passion. The mission of ACL, supporting opportunities for community living for all, has been my own life mission. And I have done lots of work through the policy and legal advocacy, and really have a deep personal understanding of the importance of the work that you all do in supporting family caregivers. I myself am a family member, and just want to say thank you for everything you do for families across the country. I know I don't have to tell you that caregivers are truly the backbone of our long-term care system. And it's so important that we don't take family caregivers for granted. And of course, respite is so critical to how we support caregivers. Respite provides family with the all-important opportunity to rest and recharge, and allows caregivers to attend to their own personal needs or the needs of other members of their family. A functional system requires well-trained and a well-staffed workforce, and maintaining the workforce is so important to services like respite and other supports for caregivers. It's become clear that without the proper support, the support that you all provide, we couldn't have the respite system that is really crucial to helping people be able to continue to support family members. And that's why our Lifespan Respite Care program and the work that you do is so, so valuable. I really want to start by thanking you. This year has been so hard for all of us. The impact that it's had on people with disabilities and older adults is truly so disproportionate, and family members have had to really pick up and fill in the pieces where people have lost supports. And respite has been more crucial now more than ever. We've really seen through COVID the pain and the suffering and the burnout that caregivers can have, and the reality of compassion fatigue. And all of you have been so crucial in really being professional, never losing sight of the human struggles that your efforts really assist. And so from the bottom of my heart, I really want to thank you for your creativity, your endurance, and for all you have done and continue to do throughout this pandemic. I want to take a few minutes and talk about some administration priorities, both for the administration and for ACL. And I think there's such an intersection with the work that you do. I want to start by COVID-19 because when I walked in on January 20th, I know I don't have to explain to you the situation that we all were in. People with disabilities and older adults and their family members were so impacted, yet very little of the response from the federal government, from Congress, had really focused on those populations. We walked in and really, really decided we have got to put responding to COVID and making sure that the populations we serve are front and center. And it was pretty incredible. Within the first few days of joining ACL, there was a national COVID strategy that came out from the White House and a set of executive orders that called out specifically the needs of older adults, the needs of people with disabilities, the needs of family caregivers, and had specific strategies and directives across the federal government. We really quickly pivoted to focus, as soon as the vaccine became available, on making sure that families and caregivers alongside people with disabilities and older adults had access. We knew that if it was just everybody register online, go stand in a long line, we wouldn't get to the people that need the vaccine the most. And so we really engaged our networks. And in March, President Biden announced $100 million of funding from the CDC to ACL to help our networks that are on the ground all across the country assist with vaccine access. And again, that is for things like helping people register, providing transportation or in-person supports, identifying people who need in-home vaccinations, or addressing vaccine hesitancy. One thing that was really important is, especially early on, many caregivers were not really counted as the essential healthcare workers that they absolutely were. There were policies that would have people with disabilities able to access vaccines, but not their caregivers. And we worked very hard, and we are thankfully really have some good systems in place to address vaccine access. We're taking on the vaccine hesitancy that remains, and we will not be satisfied with our work until every single person with a disability, older adult, or caregiver who wants a vaccine, who's willing to get a vaccine, can get one. We also were able to set up a national hotline to help connect people with disabilities with supports and to help them address barriers to vaccinations. We launched the Disability Information and Assistance Line, or DIAL, which is a companion to the Elder Care Locator line that we have. And between those two resources, we've been getting hundreds and hundreds of calls each week from people with disabilities, older adults, and family caregivers, asking for help and local resources to assist both with access to vaccines, but also with access to other services. So if you start getting referrals and people refer to the DIAL access line, know that we are actually having success. We also made sure that people understood, and this includes state and local entities and places of public accommodation like grocery stores and pharmacies, that not only is it the right thing to ensure access for people with disabilities in getting vaccines, but it's actually a legal requirement. We worked together with the Office for Civil Rights and put out a companion document, one talking about the legal obligations and one really highlighting what are some of the best practices in access. While these were specific to vaccine access, we are hopeful that these really have broader application and that we will be able to really address in other public health emergencies and crises how to really prioritize people with disabilities, older adults, and their caregivers. I want to turn next to talking about, I think, what is really a key priority. And sometimes when you come in an administration, maybe sometimes you have to stretch to connect the dots, but not in this case. President Biden and the administration have put front and center caregivers. Through the caregiver infrastructure plan from day one, President Biden really highlighted the fact that in order for us to recover, as part of our economic recovery, we have to make sure that we are both supporting people who provide care, and that of course includes family caregivers, and supporting the workforce that provides this incredible critical care. And this involves both expanding access to home and community-based services, supporting both formal and informal caregivers, and strengthening the direct care workforce. We have already had just incredible, unprecedented success. As Jill mentioned, we've worked together for a very long time in coalitions, pushing to expand funding for community-based services, and to see in the American Rescue Plan a $12.7 billion billion. We are not used to talking in those kinds of numbers. Increase to states to expand their home and community-based services is incredible. And included in that, there's a broad array of services and opportunities for states to use that funding, and specifically called out in guidance from the Centers for Medicare and Medicaid Services is supporting family caregivers, is supporting services like Respite that are so critical. So really encourage all of you to continue working with your states to leverage that funding. In addition, we saw a not only reauthorization of money follows the person, but expanding the reach of MFP, which is so critical to transitioning people out of institutions into the community. And again, once people are in the community, Respite is such a key piece of supporting them in an ongoing way. In addition, we really are thrilled, and I'm sure in a different session, Jill will be talking about some of the bills that are moving through Congress now. Not only was the 10% FMAP increase through the American Rescue Plan really a shot in the arm, but we're thrilled that the president is describing it as a down payment. And through his American Jobs Plan has proposed a $400 billion investment, really a long-term infrastructure investment in our home and community-based service system. That includes, again, an investment in expanding community services, in supporting the crucial care workforce, and supporting family caregivers. And it would be, to call it a game changer would be just a complete underestimate. This would truly, truly change the way that our long-term care system functions. ACL is also very focused on family caregiving, and I just want to also highlight what feels to me as this incredible and timely opportunity as we're implementing the Raise Family Caregiver Act and working with our advisory council on submitting to Congress a national caregiving plan. Hopefully that will be out in public soon, because we really want to get this report with our recommendations to Congress as they're moving key legislation forward. But as you'll see, both from the already public recommendations that the committee adopted in the fall and in this forthcoming report, respite is truly one of the key services, one of the key interventions to supporting family caregivers. We call that out. We call out the need for supporting our respite care system and for expanding it. And that is also true with our advisory council on grandparents raising grandchildren. Again, respite is absolutely key. We are also doing work around the direct care workforce, and of course that includes respite care providers. We know that it's been plagued for too long with high turnover rates and vacancies, and these are workers who are essential, yet who aren't given basic benefits like paid leave and healthcare. And we are working very closely with our colleagues across the federal government, at the Department of Labor, at the Centers for Medicare and Medicaid Services, to really highlight and think about strategies of what we can do to strengthen and support this key workforce. I want to just last say that in everything that we are doing, whether we're talking about COVID, whether we're talking about caregiving, whether we're talking about expanding home and community-based services, it is crucial that we have an equity lens. In everything that we do, we are really trying to implement the executive order put forth in one of the first days by our president about advancing equity. Racial justice and really through an intersectional lens is key. And so for people with disabilities or older adults who are racial or ethnic minorities, who may be LGBTQ, who may be living in rural areas, who may not speak English as a first language, face a whole set of barriers. And that's also true for their family members. Again, when the family caregiving report comes out, we really made sure to highlight some of the stories from caregivers across the breadth and diversity of communities to highlight some of the different barriers that people face. So as we do our work and as we work with grantees like you, we think it's crucial that we bring an equity lens to everything that we do. And as you're thinking about throughout your conference about what are ways that we are reaching the most underserved communities, what are barriers that exist for different communities, I really encourage all of us to think about this with intentionality and thinking about how we support caregivers that represent the diversity of American society. I will just close by saying I'm thrilled to be at ACL at a time when I feel like we are on the precipice of just incredible, unprecedented change. We have an incredible opportunity before us, and I really just want to encourage everybody, we have to seize this moment. And we really look forward to working together with you, with all of our stakeholders, to making big systemic change and supporting people with disabilities, older adults, and their families and other caregivers to truly live the lives that they want as valued and included members in our community. Thanks so much for having me, and I'll turn it back to you, Joe.
Thank you so much, Allison. I think I speak for everyone here that we are so grateful and so excited for all that you've accomplished just in your short tenure at ACL. I can't imagine how much more we're going to be able to accomplish with you at the helm over the next few years. And we're really looking forward to working with you in support of family caregivers and the people they support. We have an excellent champion at ACL, so thank you so much, Allison, and thank you for being here today.
Thank you. Thanks again for having me, and thanks again for all your great work.
That was a wonderful presentation. I'm really stoked. We can move on to our next presenters. We're really pleased to welcome Lori Stalbaum and Sarah Vogler from ACL, our esteemed federal project officers. I know, again, we are also grateful for the work they do, for their accessibility to all of us, for the time spent with us at this learning symposium. Just having the time to connect with them is always a highlight of this event, and we could not have more staunch supporters at ACL. So Lori and Sarah, I will turn it over to you for your presentation. And thanks again for being here today.
Oh, thanks, Jill. We're happy to be here. Hey, Sarah.
Hi there. Thank you for the opportunity. We're both excited to be here.
Yeah, this is great. If we go to the next slide, I'll kick it off and then Sarah will follow. So my name is Lori Stalbaum. I've met somehow or another or interacted with many of you, and others maybe perhaps we haven't met yet, but greetings and welcome. I'm considered the lead project officer for the Lifespan Respite Grant Program because my name's the one on the notice of award. So that I would, that's how I get that. I just want to say, I feel that some of what I'm going to say is going to be redundant, and I apologize, but Jill, Allison, and I all seem to be in that same headspace. So, but I'm really looking forward to this conference. Last year was my first one, and I know based on the number of people attending, it appears, and the thought things in the comments, it's clear everyone else is looking forward to it too. And I just want to say thank you to Jill and everyone on the Arch team. You always do such an amazing job, and last year's conference was a real highlight for me. I learned so much from the Bring, Brag, and Borrow presentations and the things you guys discussed and talked about and the work you're doing. It was just truly uplifting for me. So I'm really looking forward. Actually, I feel like this conference is a bit of respite in and of itself, because I know I'll leave feeling just renewed and rejuvenated. And I do want to take a little moment to echo what Allison said, because the work you guys are doing through the program, the Lifespan Respite Program, is really important. And the visibility and the awareness of need is going to become more and more known through some of the projects that she talked about, which I'll go into a little detail on later. But I also wanted to say that I know and I appreciate how hard, I kind of get verklempt at this part. I know how hard everyone's worked to keep going during the pandemic. And I know people didn't give up. I know you kept trying to find new ways to reach people, which at times was a truly insurmountable task, but you kept going and you kept trying. And for that, I just want to applaud each and every one of you. Sorry, see, I'm a little bit of an emotional person, but you guys are awesome. You rock. I want to thank you for keeping going despite professional, and I suspect probably some personal struggles over the last year and a half. And this program is still strong, and it's still strong despite the pandemic because of each and every one of you. So thank you. The slide you're seeing right now is just my way of reminding you, or our way of reminding you that, you know, we're all busy. Yep, everybody's busy, but we are available to you when or if you need us for any reason, big or small, good or bad. So please don't ever hesitate to contact us. That's why we're here. That's what why we work on this program. We love to hear from you, good, bad, big, small. We're here for you. I have a lot more to say in a few slides, but for now, I'm going to turn it over to Sarah Vogler, who's been working with me over the past year. And I do want to say I'm so grateful for Sarah's help, her insight and compassion working with me on this program. And then I just want to say thank you, Sarah, very much.
Well, thank you. Thank you, Lori, for that. I do appreciate your words. And it's been really wonderful working on this project with Lori and to learn from you, to gain knowledge. and to support you all in any way that we can. I wanted to take a moment to talk a little bit about the Older Adults Equity Collaborative. This is a new initiative through the Administration on Aging, and it supports the diversity equity lens that Allison Barkov was talking about. This is a grant program that supports 5 national organizations, and the mission and the vision is to basically allow for collaboration and cooperation to happen throughout these resource centers. So this grant program has been around for several years, but this element is fairly new in the sense that it has added an element of the collaborative, meaning that there's a facilitator basically to provide ongoing conversations around diversity, equity, to bring in speakers, to see how resources and different tasks can be kind of specified all over. So the organizations that are listed here are comprised within the minority populations. We have SAGE, NCBA, NICOA, MHP Salud, which is actually a new organization to us. It represents the Latino population, and NAPCA, which is the National Asian Pacific Center on Aging. And each of them individually are working on projects that speak to diversity and equity, and also together as a group. They really have been able to coalesce together different ideas, present their ideas at conferences, training opportunities, bring together webinars. So they've done a really fantastic job of bringing together those ideas as a group. And I'm specifically really proud of the work that they've done just in a short amount of time. They were awarded in August last year, and they've really gone above and beyond what our expectation has been. So I'm really proud of the work that they've done. As you see below, they also do technical assistance and training to the Aging Services Network and also other stakeholders and consumers. Next slide, please. So this is the new element, and it's called the Coordinating Center. And this part was awarded to the New York Academy of Medicine, and they serve as the coordinating center for the Older Adults Equity Collaborative. And they help to provide the collaboration and coordination piece. So to help, finesse those ideas and those tasks that they might have working towards them. The overarching goal really is to support their work and to respond to their needs and to respond to the needs of diverse older adults and their caregivers. The idea and one of the really great things that I'm most excited about is the resource library that they've created and is on their website, which is basically a digital resource that includes materials from each of the resource centers and also from other ACL funded resource centers. So there's an array of topics that this resource library holds, from caregiving, disability, social isolation, and mental health. So you can, the link is down, excuse me, the link is down there, and you can kind of check it out and see for yourself. But I'm really excited about this because it really showcases their work and provides other folks similarly to your work to kind of check it out and learn more about various kinds of tips and resources that is available to the Aging Network. Next slide, please. So another thing that I'm excited about, and I'm really proud of the work they've done too, is that they've been able to come together on joint projects. So as a group, they find a topic that they're passionate about and a project that they can give examples and provide personal examples to. And so this is the project that they worked on this past few months. And they really jumped on this idea as something that they are all passionate about. And they were able to give a presentation on caregiving to the RISE Family Caregiving Advisory Council. And they all did an outstanding job of really just connecting with each other on this and connecting with the audience. And they all provided personal examples as well. And it was just a really wonderful presentation, which they've have been given allocates for. So I'm super proud of that work that they've done. And the link is also below. So I just wanted to share just a little bit about the work that we've done and to give you a little taste of the things that you can kind of check out for yourselves and also implement as you see fit into your programs. Thank you so much.
Next slide. Hi, Lori back again. I do want to say on the Resource Center site for the New York Academy of Medicine, they do have a link to the presentation they gave to the RAISE Advisory Council, which I will be talking about a little bit more in detail momentarily, unless Jill cuts me off, because I got a lot to cover. The full advisory council video is there, and I don't know at what time the Older Adult Equity Collaborative presentation is running, but I would recommend watching it because it really transcended age. It was more about the equity, the diversity, just the population, the cultures. It was wonderful. Sarah, you should be really proud of it. It was wonderful. So like Jill, I want to bring up the International Short Break Association conference for a minute, because I had the pleasure of attending the 4-day virtual ISPA conference last month. I have never experienced anything like that in my life. It was amazing. It was such a success because of the hard work of, I know many others, but Jill and Lisa Schneider, who's with the Respite Care Association of Wisconsin, who's one of our sub-grantees, and Kim Whitmore of Marquette University, who I suspect more than a few of you know, because she does a lot of research in the respite field. I learned so much. There were so many great presentations that sometimes I had to figure out how to be in 2 or 3 places at one time. But what the slide shows the 6 focus track areas. And as Jill said, there was a lifespan respite track, and there were 13 presentations at an international conference coming from our lifespan respite program. I mean, how wonderful is that? Just real quick, presentations were given by New York, North Carolina, Arizona. There were a few from the various staff of ARCH, Wisconsin, Massachusetts, Nevada, Washington State, Virginia, South Carolina, Tennessee. And I know Jill said she'd be sharing that, but I just wanted to point that out because everyone was so receptive. The comments during these presentations, you know, people were chatting and like, ooh, so interested. And it was just amazing to hear our projects being talked about and people from Scotland and Australia asking questions. So kudos to everyone who presented. I tried to attend all or some of every presentation, and you guys were amazing. And that's what I wanted to say about that. Next slide, please. This is, so the Allison talked about the caregiving advisory councils. And so this, that ACL has the RAISE Family Caregiving Council, which we usually refer to as the FCAC, or the Family Caregiving Advisory Council, and the Supporting Grandparents Raising Grandchildren Advisory Council, which we usually refer to as the SGRG Council or the Grandparents Council, because we're all in a hurry and we're all overloaded, right? But so besides overseeing the Lifespan Respite Care Program grants, I'm also the co-lead for both of the advisory councils. So I'm officially called the alternate designated federal official for both of these advisory councils. The two councils, as you can see, one was established in 2017, one in 2018. Unfortunately, due to lack of funding, we didn't get to begin work with the councils until 2019. And in August 2019, we held concurrent in-person full council meetings to lay the groundwork for the work to come. And over the past 2 years, each of the councils, with the support from Greg Link, who I think many of you may know, myself and many others at ACL, we've been working towards the completion of first their initial respective reports to Congress, which is the first requirement for both councils. Next slide. So the family, oh, I'm sorry, thank you. So the Family Caregiving Advisory Council, the FCAC, is the larger of the two because they're required to address the impact of caregiving across the lifespan. The RAISE Act, under which they were formed, requires they submit a report to Congress, an inventory of federal programs that impact caregiving, caregivers and care recipients, as well as what Allison referenced, the National Family Caregiving Strategy. I'm happy to say that the FCAC report to Congress is actually going through the official government clearance process as I speak. And we expect it will be submitted to Congress and available to everyone later this fall. Next slide, please. The SGRG, or Grandparent Council, while smaller in scope, has provided us with this excellent opportunity to look at a subset of caregivers that I don't know that gets quite the recognition that there's 2.8 children living with a kin or grandparent caregiver in this country, and that number is estimated to be extremely low because most of the data doesn't look at kin caregivers, they only look at grandparent caregivers. But this subset of caregivers have some very unique circumstances and needs that don't necessarily fit with some of our current caregiver supports. And I want to point out that, like the FCAC, the Grandparent Council also adopted their own set of recommendations, 22 of them, which they voted on and codified in October of 2020. And if you go to this slide on Jill's posting, that recommendations 22 is a hyperlink to their 22 recommendations, which many are, there's some similarities between the two, but there's definite differences. And again, respite is a very big factor. And for those of you who may have looked at this year's funding opportunity announcement, we've referenced more the outcoming reports to Congress, as well as Allison talked about what we've done the last few years. We're always stressing the need for the cultural diversity and equity in our programs. Next slide. I'm trying to talk faster. As for the National Family Caregiving Strategy, that's actually not going to come out until next year. There's the reports to Congress, which are in process. And actually, I forgot to say, both of the reports will have inventory of federal programs, because even though it wasn't required by the Grandparent Act, we did the federal inventory of programs in such a way that it reflects the needs of kinship or grandparent caregivers, so that their voices are heard in there as well. But the strategy right now, the FCAC Council is working on the foundation of the strategy right now, based on the recommendations. And then the Grandparent Council will be providing input. They don't have as large a role, but they will be providing input on the national strategy, because we do want to ensure that their voices and needs are continually reflected in that final strategy and in the work that we do when it's delivered to Congress. And this final slide here, right, that you're looking at, this back one, the slide about the caregiver thing, that's just laying out the key elements that must be included in the National Family Caregiving Strategy. I don't always read my slides. I just put stuff up that I hope you find interesting. Okay, can I keep going, Jill? Okay, thank you. Because next slide, thank you. I know I'm supposed to talk about the lifespan respite program. So what I'm talking about a lot is things that are impacting and going on around your project, your programs, and things that ACL, as at least in my work knowledge, just like Sarah with the Older Adult Equity Collaborative, that are going to impact and hopefully benefit your work as we go forward. So last year in September, after the Grantee conference, we issued a different kind of a lifespan respite award. It's called Lifespan Respite Special Projects. And the thing in quotes is the whole title on the funding opportunity announcement, but we make really long titles, so I'll let you read it. But based on what we were seeing and hearing from many of you, based on my attendance at the conference, and of course, talking to Jill, we realized that we needed to focus on some key areas that we thought would be helpful to everyone, and not, that wasn't straight TA like Jill did. I don't mean that, wasn't a technical assistance piece. It was really more a development piece. So we put out an opportunity for the Lifespan Respite Special Projects. It's a 3-year grant project, was awarded last September. Next slide. It has 3 objectives. Sorry, thank you. So the first objective, again, is right in line with what Allison said about a functional respite system requires a well-trained, adequately staffed workforce. This first objective is intended to help find ways to strengthen the direct care workforce, whether paid or volunteers. And actually, this piece of the grant is being managed by Jill, Lisa Schneider, and Kim Whitmore. And they presented on this at the ISPA conference, and the chat box was on fire, and I was ecstatic. Anyway, I want to let folks know that currently they are inviting states, local agencies, respite groups, universities, other groups to apply to participate in a 1-year pilot program to test core competencies for direct care workers. The deadline for applications is August 6th. I didn't put the link on here. But what they did was they convened a work group of subject matter experts to develop the core competencies. They put out a survey to solicit public feedback, and then they adapted some of the competencies based on the survey feedback, and now they're ready to pilot test. So if you're interested in applying for the pilot test, sorry to say this, I think you can contact Lisa Snyder. Otherwise, Jill sent out an email about it. I think it was last week. Next slide, please. The objectives 2 and 3 are being overseen by the National Academy of State Health Policy, which is we call NASHP. And they're actually the primary grantee for this. And this work for objective 2 will begin later this year. What they're going to do is conduct state policy scans of respite and direct care workforce policies and practices on families and children of youth, families of children and youth with special health care needs, older adults with adults with disabilities, and review state and federal funding options to support respite and direct care workers. Next slide, please. Oh, thanks, Jill. She put it in the chat. Objective 3, again, being managed by NASHP. And the key work, this is coming after. It's a lot to do with strengthening the workforce, building natural supports, finding out what's going on out there. Key work components for this objective, NASHP is going to be holding a listening session, 1 or more, or focus groups of stakeholders to foster discussion about solutions and actions to ensure the use of natural supports and to make sure they're incorporated into the National Family Caregiving Strategy. And I believe this is going to start, they'll start this work early next year. Once they've compiled the data from the listening sessions or focus groups, then NASHP will present their findings to the Family Caregiving Advisory Council, as well as disseminate the state resources and materials to benefit everyone. Next slide. Okay, so there's a weird segue. There's a lot going on at ACL in regards to helping support your work to provide respite. I only have this one slide specific to your grants because I wanted to be sure to give you updates on the many things we're working on sort of in the background, but right out front that will directly impact you in a good way, I hope, and your grant programs and the people you're serving. But before I close, I would be remiss if I did not mention carryover requests. For those of you who are entering the second year of your project, which will be on September 1, if you have any unobligated funds, which means funds you don't have a set specific purpose, pending invoice or voucher payments, etc. for, you will need to carry over those funds from the first year of your project to the second year. Carryover requests are usually submitted after the September 30th financial reports are submitted into Grant Solutions by normally your financial people or your authorized organizational representative, but those are due September 30th. So then you know what your balance of unobligated funds are. It's noted on the slide, carryover funds can't be used for the purpose of changing your project. It's only to continue the work you're doing. And the purpose of the carryover is to ensure you have all your funds available to you from year to year. Because as a reminder, you can't use unobligated funds from year 1 for activities in year 2 unless you've carried them over into the new grant year. And this includes for those of you who got the COVID supplement funding last year in September, that money's part and parcel of your first year grant. It's not a separate grant. So those monies all go together. So if you have a little bit of that left over, we think of it as all one. And then the final bullet on the slide is a hyperlink to our document on what you need to do and know to request a carryover. Next slide. I think we may have gone over time, Jill. So I don't know that we have time for questions, but we put it up there. But we can go to the next slide and pretend it doesn't exist. Thank you.
Thank you very much, Lori and Sarah. We don't mind going over time at all because the information you have to share is so important to all of us and so timely. So thank you very much. But if you don't mind, I think if people do have questions, I would ask that they put them in the chat, and maybe you and Sarah can monitor the chat and see if there's anything that you need to respond to. I haven't seen anything so far, but if they come in, we will.
That sounds great.
Let Lori connect with you that way. Thank you both again so much.
Thank you.
Thank you so much.
Next slide, Marcia. We're really excited to launch day 1 of the Bring, Brag, and Borrow session. I know that so many of you are looking forward to that. For those of you who have done this before, you know that this is a rapid fire hour in which one person from each state shares in no more than 5 minutes a highlight of their Lifespan Respite Grant or coalition activities from the past year. It's meant to give you a chance to show off a significant accomplishment, encourage you to follow up with your colleagues if you hear something that you might want to replicate in your own state, or perhaps share a similar experience or similar resources. You can find all the PowerPoint presentations, again, video links or any documents that are shared at the link at the bottom of the page, and we'll put this link in the chat box again. So that you can access it. We would request that if you're sharing an activity that is outside your funded Lifespan Respite Grant activities, and that's fine, but we would appreciate it if you would describe how the activity intersects with or enhances your Lifespan Respite projects. We'll proceed according to the schedule that you see on the slide. We tried to group presentations by similar topics. The schedule was also sent to you in advance, and it has a column, if you have the chance to print it out, where you can jot down someone's name. If you hear something that you want to follow up on or you want more information about, or if you have a question or comment, you have that column where you can take some notes. Marcia is putting that document in the chat again for easy access. I think she posted it earlier, but it might be helpful to post it again now. when everyone's done presenting, we won't have any questions until the end, but we have a lot of time for you to ask questions of your colleagues during a 10-minute or so allotment of time after all the presentations are over. Marcia, for the most part, I think for everyone except, well, just for everyone today, she'll be advancing your slides for you. So please remember to let her know when you'd like her to advance to the next slide. Next slide, please, Marcia. The first topic is system sustainability and network building. Next slide. And we have Sarah Schmidt from Arkansas. If she's with us, please proceed, Sarah. Unmute yourself and share your accomplishment.
Sure, thanks, Jill. So my name is Sarah Schmidt. I'm the Deputy Director here with the Arkansas Department of Human Services, our Division of Provider Services and Quality Assurance, which holds our lifespan respite grants. So if you want to go ahead and go to the next slide. What we're going to talk about for ours is our Lifespan Respite Summit that we are doing for the state. This is the first year that we are doing it 100% virtual. And we actually learned a lot from the ISBA conference watching that. So you can go ahead and go to the next one. Our summit is actually going to be in about 2 weeks. It is a 3-day summit that we are doing July 27th through the 29th. We began planning for this in late May. We are holding workshops with our coalition, the speakers that are included in our event weekly, sometimes twice a week. Since May up until the end of it, we are about to go into rehearsals next week for our event. During that time, we also went ahead with our Respite Coalition logo and infographic and brochure and totally revamped those, put a new look to them with new information so that we would have that available for our event. It is a 3-day conference. We're using the Hoover event management application. I don't know if any of you guys have used it before. We did choose that event application because it does allow for anyone who registers for that event to have full access to everything that happened during the event, all the videos, the files, for up to 90 days after the event is over. We are having the event free because it is being sent out to caregivers across the state, as well as our respite providers. So we wanted to make sure that those caregivers had access to go back in and look at it if they had to jump off for a caregiving situation. We're also doing pre and post surveys on that. The governor of Arkansas and our Arkansas DHS secretary are both going to be doing welcome messages for our event. And the governor is expected to proclaim that week the Arkansas Caregivers Week, which I do believe he's going to talk about in his opening. Right now, we have about 27 speakers. At the time I sent this in, we had about 56 people registered. This week, we started to do our big media push for it, and I believe we're up to almost 90 now. We have it set for about 500, but we anticipated about 200. So I think we're almost halfway there. You can advance the slide. So the way that we broke down our summit is our 3 days are kind of focused on different areas, but everyone is welcome to attend all days. So day one is really a caregiver focused, just kind of talking about what is respite. We're doing caregiver community connections, which are breakout rooms with several different topics, several different communities. For example, an Alzheimer's community room, we have an autism community room, traumatic brain injury room, any kind of room you can think of, where we're going to have professionals in that field sitting in those rooms that the attendees can kind of come in and out of, ask questions, look for resources. So kind of like an informational booth, but in a virtual way. That afternoon, then we're going to do breakout sessions in different categories there. Day 2 is really more provider focused, where we're going to talk with our respite providers about how to identify a caregiver's need, our respite training, serving our underserved populations, building a statewide network, and then providing respite in a creative and innovative way. Next slide. Day 3 is going to be our collaboration day. This is bringing our caregivers and our providers together. In the morning, we're going to do a panel discussion just about surviving the caregiver experience. And then in the afternoon, we're going to tackle our sustainability planning with going through the sustainability toolkit. If you'd like to register and attend, again, anybody can attend. The link is down there below to both the webpage and then registering. Like I said, it is free. But if you guys have any questions on how we put our event together, feel free to reach out to me. Thanks.
Thank you very much, Sarah. Next up, we have Lynn Fines from Idaho. If she's with us. Lynn, you might want to unmute yourself.
Good afternoon, everybody. Next slide, please. Thank you. So as part of Idaho's Lifespan Respite Project, Boise State University Center on the Study of Aging conducted a strengths, weakness, opportunities, and threat, or SWOT analysis in our Northern Idaho Area Agency of Aging Region 1, South Central Idaho Area Region 4, and Southeastern Idaho Area Region 5. To achieve this, one of Boise State's objectives was to conduct separate focus groups in these regions by soliciting participation from outside organizations with boots on the ground that provide information and assistance and other supportive services in their communities. This slide illustrates the results from the SWOT analysis conducted in Idaho's Northern Area 1. Some of the strengths identified were AAAs having existing partnerships, established trusts in the community, and the infrastructure in place. Some of the weaknesses identified included the AAAs are recognized as serving older adults. There's minimal experience marketing to the younger demographic and limited funding and personnel. Some of the opportunities identified were the opportunity to expand partnerships with healthcare systems, social workers, and care managers, work with other organizations engaged with younger populations, and connect with college students pursuing health-related careers. Some of the threats included the high need of respite across lifespan may overwhelm the capacity of our AAAs and the perception of AAAs competing with providers. Next slide, please. Thank you. Now, this slide represents the SWOT analysis results from Idaho's South Central Region, Area 4. Of course, many of the same reoccurring themes were found, including the area agency's strengths and community connections, their established relationships, trust, and the strong leadership found in these organizations. In contrast to the weaknesses found, such as difficulties making that cultural shift and learning how to market to the younger populations, those not recognized as themselves as caregivers, and the limited amount of time, funding, and personnel dedicated to the multiple ongoing programs in our area agencies on aging. These strengths and weaknesses highlight potential opportunities to partner with college programs and students, healthcare workers and school counselors, and other community-based organizations. Next slide, please. Thank you. In summary, while participating in these lifespan respite focus groups and multiple symposiums, I found myself representing the Department of Health and Welfare Services that cover the spectrum of youth and behavioral health and other DD waiver respite programs. And that led me to the conclusion, well, and borrowing from other state and local nonprofit initiatives, of the need to start partnering with Department of Health and Welfare in developing comprehensive training to inform staff of family caregiver respite services across state agencies as we move respite forward. Thank you. That's all I have today.
Thank you very much, Lynn. Next up, we have Leanne Winchester, and Amy Nazaire may be presenting with her as well. Please remember to unmute yourselves and turn on your camera if you're able to, please.
Hi, everyone. My name is Leanne Winchester. I'll be presenting the work that we've been doing in Massachusetts with the Massachusetts Lifespan Respite Project. And what I'm presenting is a major focus of the work we've been doing over the past year. I have presented previously on the work to date through our project. This is our third year into this round of the grant funding. So next slide. And so a major part that we've been working on is continuing to build on the challenges that the Massachusetts family caregivers have been experiencing. This, of course, I don't think it's a surprise to any one of you, is that the challenges for family caregivers to try to navigate statewide systems and services. This is just a small snapshot of the complexity with Massachusetts and how a family caregiver might need to look through each one of these different programs to find the resources that she or he needs. And so recognizing this, the coalition, we had done our SWOT analysis in 2018, and what we had identified through our project is that the strengths were that we had many, many systems, but the weakness is that the systems worked in isolation of one another. And if we had to truly look at the family caregiver as one part of a full unit, which is the person with the disability and then all other members of the household, how do we support that individual? And so we really had to look at what was going on within the family, the eligibility that exists within that family, and then also how we would connect that family with services. Another challenge that we had identified is that the definition for respite varied across different state programs. And so while a family caregiver may call, for example, the Department of Mental Health and ask for respite services, well, respite is actually defined as companion care at Department of Mental Health. Whereas if the family caregiver were to call Elder Affairs, it is called Family Caregiver Support Programs. And so, it was so complex. We really needed to get a handle of what was happening at the state level so that we could work together at the state to make it easier for the family caregiver to access this information. And so with that, the coalition joined together and identified two primary tasks, which is to create a training that would focus predominantly on educating the care coordinators that work directly with the families. And these are care coordinators across all state agencies and professional programs. And it was to help them to understand the full system in Massachusetts so that when the family caregiver calls them and says, help, I need someone to help me, I need support. We all know those key terms, that they will be able to understand quickly what is happening, to be able to look at the family and say, all right, let's get a full scope of what's happening here and be able to refer you appropriately. The other thing that the coalition had identified was the need to have one central resource center. And so working within Massachusetts No Wrong Door system, what we have is a program called Mass Options, and Mass Options is the central referral network. Now, what we did find, similar to what Lynn was just saying to us, oftentimes the programs really referred people through the AAA. So the primary focus was elder services or elder affairs and older adults or people with physical disability. There seemed to be a gap within the system when referring family caregivers of children with disabilities children with special health needs, and even folks within our IDD and SHIP population, excuse me for the acronym soup here, our state head injury program and our intellectual developmental disability program. And so we needed to really strengthen that. And so we've been working very closely in Massachusetts with our partners at Mass Options to really broaden out how calls would come in and how the call representatives would refer families to services. And so next slide. And so this is just a preview of the training that we are creating for our professional population. And right now the title is Accessing Respite for Massachusetts Families. However, I will say we are in the process, we've created the whole storyboard and the script, everything is in place, but it looks like we might be changing the title. And that is because we often live in an acronym world. And when we look at the acronym ARMF, it doesn't really say anything. So we're sort of reformatting the title so that the acronym that would come from the title would be something that would really identify what folks are accessing or what they're doing with this online training. So it seems like a little bit of a, why would you do it? But I think that we can all understand the acronym does make a difference. And so that is why we're sort of playing with the title just a little bit. But the training itself really does look at the introduction, and the introduction is to explain to the care coordinators and other professionals what respite is and who our family caregivers are. It also does clearly explain Massachusetts' system for providing services to family caregivers. We, in Massachusetts, I'm sure you all know, we spent an extensive amount of time creating a definition. So it does share the definition of respite so that all programs across all managers across the agencies will be able to identify what it is within their program if the title is other than respite. And then it also begins to have them think about their experience as a care coordinator working with families and some of the calls that they might get or some of the experiences that they might had and some roadblocks that they might have faced. And I should say, to just sort of piggyback on this, what we had done previously this year was we had conducted focus groups through the Zoom platform and phone interviews to really get a sense of what the what the case managers, care coordinators were experiencing. And that's really what helped us to feed the information, put this information into the module. So then the training does go on and looks at the caregiver perspective. And we are in the process of creating a video right now. I just got off a call with the videographer right before this meeting and narrowing down all of the interviews that are being done. So we're excited. This should be done within the next couple of weeks, and we will be embedding this caregiver perspective video to really drive the message home. We feel that the caregiver voice definitely needs to be in there. And then at this point, we transition the online training to what each of the state agencies are, what the eligibility is for the state agency, how to access services, as well as what are the limitations within the state programs. And then we continue the learning experience to the Massachusetts No Wrong Door system, which is Mass Options. From there, we do have very interactive activities, and we begin to offer them a series of questions that they do through some online activities to be able to ask family questions. We have case studies, and then we put it all into practice. And so I will say that this is very interactive. It's fully accessible, closed captioning, narrating, screen reader. And it is, it's a wonderful project. I'm really excited about the product that we will be producing from this and the benefit that it's going to bring all the different state programs and ultimately to the family caregivers who will no longer have to be navigating through all these many systems trying to find support. And so Lynn, I'm curious who is creating the training modules. So it's Commonwealth Medicine, if that question is directed to me. But so Commonwealth Medicine at the medical school is creating this online training. And we did transition it to online training because of the COVID. Initially, it would have been face-to-face, but it's actually the online proves to be ideal. And we are looking to host this training within mass.gov, which is our state system, as well as within our provider program. So we are hoping that at the end of the day, it's not a long training, probably about 15 to 20 minutes, which doesn't seem like a lot. But when you're doing a training like this, the intent is to just really give them the information that they need to know and then provide them with a resource to be able to send families to. And then we can continue to build on it. And so this is the introduction. Many of these caseworkers have been working in the system for a long time. They know their system very well. They know something about some of their sister agencies, but this will really help to build out their information. Okay, next slide. And so this is the last piece. This is the no wrong door mass options. And this is a process flow that we created. And this is when family caregivers call into mass options. And that operator on the other end of the call picks up the phone and says, thank you for calling mass options. How can I help you? This is the beginnings of the process flow that we created to really guide that. And so you can see, well, you can't really see it, but maybe when you get the slides, you'll be able to see it. We collect a lot of data at the very beginning, demographics, age, information. We ask a series of questions to really get a sense as to why the family caregiver is calling. And then we have a system on how we would refer them out. And all of this information that will be captured is trackable, and we will be using this data to really look at how we can continue to enhance systems and within the programs going forward. So this is what I was hoping to share with you, is this process flow. This is the draft, but if any of you are interested and want to learn more, I'm happy to talk about it. Thank you.
We have had some really fantastic presentations so far, and thank you so much for that, Leanne. I would remind us going forward that if you could limit your presentation to 5 minutes, we'll be sure to get through everyone who's scheduled today. Next, we have Marissa Bueno from Montana.
I am going to keep my camera off for internet reasons, but I'm ready to go. So I'm Marissa Bueno. I'm the evaluator for Montana's Lifespan Respite program. Our executive team wanted to share a program element we started in 2021 to interview caregivers across the state. This effort began in February and will be ongoing for the duration of the program. The interviews were initiated with several purposes in mind. First, to understand how respite was benefiting caregivers, respite providers, and those receiving care, to better understand what caregivers and care recipients' lives look like and how respite helps, to learn how people are spending their respite time and what uses are most beneficial and why, and to discuss what else caregivers need. All of this is useful for knowing what's working, what needs further investment, and what other initiatives could be helpful. And the information is also useful for making decisions about how to use limited resources to meet the needs in the state. Data thus far has deeply informed our program design and grant submissions and will help guide policy design as we approach the state to consider sustainable support of the program. In order to recruit participants, the program director sent postcards with our renewal packets for the $600 per year lifespan respite vouchers. The postcard had a brief description of the purpose of the interview, and people could opt in and provide their ideal call times and numbers. Interviews thus far have been with current caregivers utilizing the Lifespan Respite voucher program, though we'd love to interview respite providers in the future. The person receiving care is often in the room with the caregiver during the interview, so I have been able to hear their feedback during their interviews when it was appropriate as well, and that's been really lovely. The interview protocol has 9 categories of open-ended questions, including what caused the caregiver, change slides. What caused the caregiver to seek respite and where they learned about the program. Their experience as a caregiver, including rewards and challenges of caregiving. Their experience with the Lifespan Respite program and finding a respite provider in particular, as we've found that to be a challenge in some communities. What other forms of support would be useful, building on research and conversations with providers. We start that conversation and through the interview process. and then how they use respite and how respite has helped. What we've learned thus far is that respite's a highly valued program that helps caregivers keep going. And what we're finding, which will be no surprise to this group, is that there's high return on small investments in respite. This is due in part to the fact that caregiving affects all parts of a family's life. Each caregiver experience is unique because of the circumstances that create the need for caregiving, the individual mindset of the caregiver, the family dynamics, the support systems, the financial capacity. But there are trends across caregivers regarding the benefits and strains of what that's like. One of the common trends is that the ability to get a break has multifaceted benefits, and the financial help getting a break makes it easier to take a break. Having financial help also means that resources that would have been spent on respite can go toward direct care. We've also learned that the program is easy to use, but confirmed that finding providers can be challenging, particularly in rural areas. We found that the use of the lifespan respite voucher varies, but also falls into common categories, which is really interesting. We've also repeatedly heard that caregivers would like to feel part of a broader community of support, and we've purposely designed pilot projects over the next 4 years in line with this expressed desire. And finally, spending time with reflecting on their experience and being asked for their feedback in and of itself has been valuable to people. They seem to enjoy the interview process, or report that they do, and also felt that tools that they've been sent to help measure stress help them feel like someone cared. Everyone interviewed thus far has enthusiastically volunteered to advocate for the program or speak to its benefits. And we provided a list of quotes from interviews that represent the kind of feedback we're hearing about how and why respite is so important. That was provided in the resources files. These interviews have provided really valuable programmatic information, and the stories have inspired our team to fight for continual improvement of the program. And I'll just quickly share one quote, which was, when our son was injured, it was devastating and life-changing. The whole family, even our dogs, was affected by the change that happened to our lives. Unless someone has been through something similar, it's hard to explain to people. And I've lost friends. People don't know how to handle it. We all go through periods in our lives where we've lost friends because we move in different directions, but we have things we gain in those times too. The difference here is that with this change, we just lost. Getting respite has allowed us to gain something back that we've lost. Even if it's as seemingly trivial as a bit of time between husband and wife, it gave us back one small thing. It's huge in our lives. We can't just do what we want whenever we want. This is life-changing to us. Thank you.
Thank you very much, Marissa. Next up, we have Cheryl Donnell from Nevada.
Hi, everyone. My name is Cheryl Donnell, and I'll be the spokesperson for our group from Nevada. And I'm going to put my contact information in the chat, just in case you have any questions for us. And then next slide, please. Yeah, actually past that slide, keep going, another slide. That was just to introduce us. We are in the middle of a transition. Our coalition was born in 2007, and while incorporated as a nonprofit in the state, the Nevada Lifespan Respite Care Coalition, NLRCC, is not a 501c3 organization and has relied on fiscal agents to receive funds. NLRCC has found its sustainability hampered when the fiscal agent or individual board members would not sign off on grant applications that might compete with their own applications for funding. So another way had to be found, and reviewing options. An advisory board structure was accepted as the best alternative and will free NLRCC from conducting fundraising activities to support its administrative needs. So we are going through a transition. The name will be the same, but new bylaws have been approved and new representation on the board will come from perspectives or voices desired for an ideal board. Obviously, we didn't have the right people on our board. And so even though they were good voices, we need more voices, different voices. And this will require an extensive recruitment effort currently ongoing to cast the net more broadly than in the past. Aging and Disability Services Division will support the board with staff and funding, so even secretary and treasurer positions will not be needed. This will also put NLRCC on the same policy level as other state boards and commissions, none of which represent family caregivers in any significant way. As they focus on individuals that we'd more likely call care recipients. But we see great opportunities ahead to partner with these state boards and commissions and advocate for caregivers on multiple policy agendas. And our main transition plan is going to be available very soon, and hopefully our onboarding training and resource materials in the near future. The launch of our new advisory board is planned for September of this year. Next slide. While caregivers have been a focus to everyone's consciousness during this year with COVID, and in our continuing desire to have data on respite, Aging and Disability Services Division, ADSD, has met with some sister and community agencies and have proposed some items for common data collection. When it comes to making systemic changes like this, however, there are challenges, and the approach needs to be well thought through, very collaborative, and gain pertinent buy-in from the others. So we are taking baby steps in a long view on how we can phase in these data points and collect it on a statewide level. An agreement was reached to start the initial data collection with information that all the agencies are currently gathering. Through planned quarterly meetings, we'll have a chance to look at the data collected to date, see how the collection processes are working, and plan our next steps for adding in additional data points. And this phased approach will provide agencies time to put systems in place for collection. The agencies include those that provide specific caregiver supports and respite to our communities, and they're located throughout Nevada in urban, rural, and frontier areas. And this includes our developmental disability services, our regional centers, the community-based care services through Medicaid, the Division of Child and Family Services, and also in partnership with Nevada PEP, which is our state parent training and information center, and the ADSD grant unit, and the FRCs, our family resource centers. And so I will let you know how our progress goes forward. And that's all I have for you today.
Thank you very much, Cheryl. We're moving on to our next topic now. The next few presentations are on the topic of caregiver education and wellness. And first up is Tracy Sinowitz from Alabama.
Hi, everyone. I am Tracy Sinowitz. I'm the director of the Alabama Lifespan Respite Program, and I'd like to share with you today about an opportunity we identified during the pandemic to better serve the overall well-being of the caregivers that we work with. As we shifted program delivery during the pandemic, staff began making welfare calls to simply just check in on the caregivers we serve statewide. We wanted to know, how are you doing? Are you able to utilize your respite voucher? Do you need PPE assistance? And of the more than 700 caregivers that we spoke with, many just wanted and needed someone to talk to. And one of the wonderful things about the Alabama Lifespan Respite Program is our ability to respond to caregiver needs in real time. So we immediately began offering scheduled care chats for our caregivers, and it gave them the opportunity to talk with one of 3 social workers that we have on staff for up to an hour each week. Those were scheduled times. And we also converted our monthly break support group, which was on site locally. We converted it to online and offered it to all of our caregivers statewide. During our breaks, we have played bingo, we've gone on scavenger hunts, we've decorated holiday cookies together, we've had sing-alongs, and we even hosted a murder mystery party. So we've done some awesome things to give our caregivers a little bit of a boost. These efforts gave caregivers opportunities for one-on-one support with a caring respite team member, as well as broad support through group activities with other caregivers, including the opportunity to connect with their peers outside of our group activities. We also distributed care packages, increased mental health and wellness education opportunities to increase the overall caregiver wellness during the pandemic and beyond. But while these efforts help caregivers to deal with the sudden loss of respite breaks and the intense isolation as the result of the pandemic, many caregivers that we work with express the need for professional mental health support. We were fortunate to be in grant writing season and saw the opportunity to build upon all of these new activities by creating the Caregiver Wellness Initiative. Next slide, please. So what is the Caregiver Wellness Initiative? To further support the total well-being of our unpaid family field caregivers statewide, we established the CWI to provide funds specifically for free mental health counseling to the caregivers currently enrolled with any Alabama Lifespan Respite reimbursement program. We manage lots of funds for our AAAs through the state, as well as Department of Mental Health, Children's Trust Fund, as well as our universal funds through ACL and ADSS. So anyone enrolled in any of those programs is eligible to apply for our Caregiver Wellness Initiative. Why is it needed? To decrease stress, anxiety, fatigue, and burnout, hopefully resulting in an increase of overall caregiver wellness. Physically, mentally, and emotionally. We want to do what we can to take care of the caregiver as a whole. And we also, of course, want to always help possibly prevent that premature out-of-home placement of the care recipient. So how have our caregivers learned about CWI? We have shared information via direct mail, through email, website, social media, through our respite education opportunities that we offer. We always tell them about it and it's available. And through our agency partners, through the AAAs, through Department of Mental Health, through our coalition, and new applicants. When they fill out an application for respite voucher services with Alabama Lifespan Respite, there's an interest question on there. Would you be interested in receiving more information about free mental health assistance for caregivers? How is this funded? Like I said, we were fortunate to be in grant writing season. So part of this is funded through our ACL Federal Lifespan Respite Grant. And then we also have 2 grants from local foundations, the Daniel Foundation of Alabama and the Venturi Brighter Day Employee Fund. The program was launched in February. We have a really simple online application, or when caregivers call us, they can apply by phone. We want to make it as easy as possible for caregivers to utilize this program and have access to mental health counseling and care. Next slide, please. So how does the program work? Basically, there's all the information here, but basically each caregiver who's eligible, and like I said, eligibility is basically you're enrolled with one of our programs and you express the need for caregiver mental health assistance. Those caregivers receive a stipend that allows them up to 3 counseling sessions for the first stipend to be used with a licensed mental health provider. We have established a list of available mental health providers statewide who are familiar with caregiving specific mental health issues. And all of those providers are available on site or via telepractice. And if the caregiver feels more comfortable with telepractice but doesn't have a way to access it, then we do provide them with a tablet to be able to access teletherapy and access their mental health sessions. We pay the provider directly. The caregiver never has any out-of-pocket expense or has to deal with insurance or anything like that. Once they have used their 3 sessions, if they agree with the mental health provider that more sessions are needed, then we will give them an additional stipend for 3 more sessions. We've had great success so far. Like I said, we launched in February, and so far we've awarded counseling stipends to about 70 caregivers. And we do a pre-test and a post-test, if they're willing to do that for us. It's completely voluntary to assess the effectiveness of the program so far. And so far, it seems to be going really well. The caregivers who have completed their counseling sessions already have, they've sent thank you notes, they've sent emails, and just that contact is so much better than a survey, I think, for them telling us how much it really helped. This also allowed us to increase our emergency respite funds. So we're usually out of those mid-year. So this gave us enough for, year-round emergency respite. So when we have those caregivers call and say, I am at my breaking point, I need this break, or I'm afraid I'm going to hurt myself or my care recipient, then we have those additional funds available to be able to address those specific caregiver mental health situations as well. So all of this information is on our website at alabamarespite.org, and feel free to contact me if you have any questions. Thank you.
Thank you so much, Tracy. Now we're moving on to Megan Bettinger from Colorado.
Hello. Sorry, I couldn't see myself. I'm going to present today a video, and I'm going to tell you a little bit about that. So during the past year, thanks to grant funding from the federal grant funding and the state of Colorado State Unit on Aging, Colorado Respite Coalition was able to partner with PASCO, which is a local nonprofit personal care agency. And what we had them do, they wrote scripts and they were reviewed and signed off by their nursing director. And so we hired a video production company, and he created a first set of 6 videos that are about transferring individuals with mobility issues. And for example, how to transfer an individual to a bathtub from a wheelchair. So these videos, along with PDF guides, are on our website. The figures in the videos are computer generated, and they have general male and female characteristics, but there's nothing specific. The idea being that we can focus on the actions, not on that we're highlighting, not on the actual people. We did a second set of videos. Yes, thank you. So let's see, where am I? So they're more on broad subjects such as activities of daily living, such as feeding and bathing, in addition to CPR for infants, children, and adults, how to avoid pressure wounds, and finally, developmental milestones and aging. Again, they're general education videos and not necessarily training videos. They're just something that's on our website, so you can have just an overview of the subject matter. This new set of videos will be uploaded shortly. We're waiting for the PDF guides to be developed, and then we will share with everybody when that information is completed. If you all don't mind, I have a video to show its signs of aging in parents. It's about 2 minutes, 45 seconds long.
It's not always easy to recognize changes in an older adult's behavior, especially if you don't live close by or see them on a frequent basis. There are warning signs, however, that can help determine whether an aging parent or relative may need assistance. It's important to know what steps to take, starting with notifying your parent or relative's physician, should you observe any of the following changes in their physical or cognitive abilities. Your parent or relative experiences loss of appetite or misses meals, resulting in lost weight and overall poor nutrition. Be aware of dehydration as well. Cleaning clothes, washing or showering, managing body odor, oral health, brushing teeth, nails, and skincare are all neglected. The older adult fails or simply forgets to keep their home clean, resulting in noticeable changes in tidiness and even sanitation. Unusual and atypical behavior, such as being overly loud or quiet, paranoid or agitated. Making phone calls at strange hours is another indicator of behavioral change that should be taken seriously. Your parent or relatives acts oddly or distances themselves from neighbors and friends, causing them to be concerned about your loved one's well-being. Burn and bruises and other wounds appear more regularly, indicating possible forgetfulness, general weakness, or maybe misuse of alcohol or medication. Your parent or relative is social and active, yet suddenly stops participating in activities he or she always enjoyed, like book club, bridge, eating out with friends, or going to religious services. Absent-mindedness or minor forgetfulness are probably not a cause for concern. But if episodes become frequent and more serious, such as amassing piles of unopened mail and newspapers, missing appointments, not refilling prescriptions, or leaving a burning stove unattended, then action may be needed on your part. Failing to pay bills, paying bills more than once, and losing or hiding money are all signs that an older person needs help handling daily activities. This red flag typically includes things like ordering more than one subscription to the same magazine, entering an oddly large number of contests, or inordinate purchases online or from TV advertisements. Whenever visiting your parent or older relative, look around their home for its overall condition and for any signs of neglect. Check for safety hazards and make sure thermostats are properly set and working. Sometimes you may need nothing more than a simple fix, and others may require more serious action and having to make difficult healthcare decisions. Your first consideration, however, should always be in the best interest of your parents and fulfilling their wishes whenever possible. Please visit our websites to learn more about caregiving resources and training.
Next up, we have Nick Slentz from Virginia.
Good afternoon, everybody. Those last two presentations were very interesting, and I plan on following up with both of you. I don't have any slides today or videos, but I did want to talk about the Virginia Caregiver Coalition resource guide that the VCC and the Department for Aging and Rehabilitative Services have been working on most of the pandemic. We didn't think it would take as long as we did. So I'm going to try to stay on script so I don't go over here. So I'm not sure if it's more of a bring or a brag, but the VCC, myself and my coworker worked for many months on this, and I feel a certain type of way about it. So the guide is a 100-page single-sided behemoth. So there is no way I could cover it all in 5 minutes. But I would encourage anyone who is thinking about creating their own caregiver guide to peruse ours before maybe starting their own project. The VCC had originally created a guide back in circa 2010. So we didn't have to start from scratch. However, the guide read more like a phone book, and we felt that to bring it into, the 2020s, we wanted to kind of simplify it. I mean, most people, you think, are looking at Instagram or, tweets and, short articles, catchy headlines, things like that. So we wanted to kind of make it more visually appealing to catch people's interests by designing it kind of more like that. So we reworked it. We had presented it to the caregivers and professionals who are part of the VCC membership, got their input on it, and then we reworked it again per their feedback and then brought it back for final approval. Our first goal was to try to break up the guide into sections that listed what we thought would be essential starting points for any busy caregiver. The design was where the sections could actually be removed if they thought, they only wanted one part of it, or they could, look at it more comprehensively. So the way we organize the guide, it starts with an introduction on, how to use it, the definition of being a caregiver, benefits of being a caregiver, and some basic demographics associated with caregivers in Virginia. The next section after the introduction is how to care for yourself. We thought that in order to be the best caregiver possible, you needed to be able to take time for yourself to reduce burnout risks and understand the importance of respite. So we had a lot of discussion about moving that first and foremost in our guide. The next sections after that is caring for another person in general. It contains a general list of services and supports that you may have access to around the Commonwealth of Virginia, tips for creating a care plan, how to gather resources effectively when you're, calling these agencies and organizations, and a very basic list of general services such as Medicare, Medicaid, SNAP, Social Security, very basic starting points that anyone, should kind of begin with. The guide then moves into a more specific sections, which are older adults, people suffering from dementia specifically, people who are caring for someone with any type of disability, parents who are caring for someone with a child with autism or an individual with autism, and then grandparents who are caring for a grandchild. We had a lot of discussion about which ones we thought needed to have a more dense, kind of information in each section. So the way each section works is you have a list of essential resources that pertain to each kind of type of caregiver. And then we break it down into 1 to 2 page topics that people may find useful or helpful, with either phone numbers, links to more information, or references to later parts of the guide. And then the back of the guide contains a comprehensive resource list that breaks down, services, statewide services by topic and then alphabetically. So we list all of our area agencies on aging. We list, our major departments and things like that, all of our SILs, AARP, things like that. We wanted to kind of have it broken down by topic and have it where this is the organization, this is what they do, here's a website, here's a phone number, if you really just want to go, line by line and check it off. So the goal of the guide was to make it something that could be updated, kept in a digital format for people who are more tech savvy, but also we wanted a guide that could be printed off, put into a paper format, and could be mailed to our rural caregivers who may not have access to the internet, or older individuals, or anyone who just prefers a hard copy of things. We are also working on finalizing a Spanish translation that could be in print and digital format. And also we're working on creating a large print option for people who may be visually impaired or just want to read it in a larger print. So this was my first resource guide, and I have to say I did learn a lot. It took more time than I ever thought it would. And I spent many weeks of discussion arguing about fonts that would be better suited to formatting and background colors and stuff like that. But we wanted to help caregivers in Virginia, especially older and rural ones, and that's kind of where we were looking to. And that's all I have, and I'll be happy to share the resource guide with anyone who would like it.
Great, thank you very much, Nick. Is it available now, the final, or?
We are still waiting on some final formatting, but it will be coming up hopefully before September.
Okay, so everyone will be looking forward to that. Thank you so much.
Thank you.
And we're moving on to the next grouping of topics, which is generally outreach and COVID-19. Now let's move on to Renelle Baker and Aida Stevens from Oklahoma.
Hello, everyone. It's actually just going to be me, Jill. So
okay.
Aida is having some connection problems herself. So I'm Ronelle Baker. I am with the Oklahoma Human Services. I am the Lifespan Respite Grant Program supervisor. Fairly new to my position, but next slide, please. All right. Our first thing that we're going to talk about, or that I'm going to talk about, is our Oklahoma Statewide Family Caregiver Conference. We're under the COVID category because we changed our conference up last year. At the beginning of COVID, we made the decision as a team to make it virtual. We didn't know how it was going to look or how well it was going to go. And we, to our amazement, I think it was very successful. We did a 2-day conference. We had approximately 190 attendees over those 2 days. I have our program right there in the middle. I don't know if you can see it too well of the things we covered. But during those 2 days, we had 23 presenters, 22 sponsorships. We, at the end of this conference, we met and did a debriefing, and we decided right then and there, we don't know what COVID's going to do. We're going to do 2021's virtual again, and we've already got that in the works. Our conference is going to be November 10th. We did have a lot of feedback that 2 days it seemed a little long for some of our participants. So we're doing 1 day this year. And we do have some breakout sessions. One of the best things that our participants loved is that we had a DJ who did, anytime we had a breakup of sessions or anything of that sort, he was so lively and just fun, and the music, because it was a celebration. So why not bring in some music and liven it up, being virtual. And then we also, all of our door prizes, they were all a virtual gift card that we were able to give out via an email. There was literally nothing that we had to hand out or go track down somebody. We were just able to do it right there virtually, and it was very successful. So we're really looking forward to this year's. I think it's going to be even more off the chart and just amazing. So looking forward to that in November. The next thing I'm bragging about is our Caregiver Coalition. Coming new into my position, we had put that we have over 160 statewide partners. I'm actually updating that list, and we're actually to over 200 statewide partners on our coalition. So I felt that needed to be bragged a little bit better. We do have our 8 subcommittees. They were established after statewide needs assessment. We do meet quarterly, and actually our next meeting is tomorrow. So again, because of COVID, we decided to take our coalition completely virtual. We're still doing that. And we actually have seen that we have even higher attendance, being that it's virtual. A lot of our statewide partners are obviously able to attend virtually because they don't have to drive to the city. So it's been very successful in keeping that rolling. COVID tried to stop us, and we are not letting it. So next slide, please. All right. This is the part that Aita was going to share on, but again, she's having connection issues, so bear with me. I was actually still part of Sooner Success when we started this one. We did a family caregiver bag distribution throughout the state. This is our borrow that we do believe we borrowed this from the state of New York. You guys had spoke about this, and we loved it, and we had to make it happen, and we were able to do so. We were able to distribute over 1,000 caregiver bags. And just bear with me because I get emotional too. So Lori, that felt good that you got emotional. But I'm just going to share a quote. It says, "Being a special needs mama has introduced me to so many amazing people that I wouldn't have known otherwise. Today one of those amazing mamas dropped off a care package, and inside was all kinds of stuff that I never would have thought to ask for. Things that encouraged me to rest, relax, focus on healing. These are only a few of the items from the bag, and I'm so thankful. This person happens to be on our call right now, and it was Stephanie Red Elk. So another reason why I wanted to shout out this one, because she is amazing. So Stephanie, I'm so glad you are in my world. You're such a sweet friend. Thank you for your thoughtfulness today." I just love that one. I know I had a lot that were shared, and that one just really hit me. I'm also a mama of a child with special needs and a caregiver to my mother-in-law. So our bags impacted people greatly, and that was just amazing. It took lots of effort, and we also collaborated with some state partners who also made that happen. The next, oh yeah, sorry, I had to see where I was at. Again, COVID related, we made a lot of changes to how our respite looked. We lifted a lot of restrictions such as income restrictions. We lifted that. There was no floor for that. Our emergency vouchers were $250 prior to COVID. We increased it to $300. We also increased the amount of respite vouchers to $400 every 4 months. All these things just to meet the needs of our families, because COVID really struck hard and is still striking hard. So those are a lot of the changes we want to highlight that we made. Next slide, please. All right. Another thing that we changed was our SIB shops. It kind of went to, not necessarily to the wayside, but we had to think, how can we still make this happen? Our siblings need to still have that time for themselves. And so we held a statewide virtual SIB shop, and it was phenomenal. The siblings loved it. I don't have the numbers. I just know that it was a great hit, that there was a great turnout. I do believe that they plan on doing more that way, and I do believe have continued doing those. The next highlight is the ADRC community partnership grants. We also call them mini grants. Let me pull up what was sent. I apologize. They're still underway, and currently we have funded 25 partners throughout the state for a total of $93,500. to help with these mini grants. And there's different things that they can do. I don't know the ins and outs of what some of our partners have done. Some can still be those caregiver bags if they want to create some of those and distribute them again further throughout the state. Our goal is to fund $146,000 by the end of August, and clearly we're already halfway there. I think that is all that we have. So thank you for letting me share, and thanks for listening.
Thank you so much, Ronelle. You have so much going on there in Oklahoma. Next up, let's go to Megan Schwam, and then we'll come back to Tina. Megan Schwam from Tennessee.
All right. Hi. It's perfect actually for me to follow up with Ronelle, because so much of what they did is similar to what we did this past year. Last year at this session, I talked about our COVID interventions. We, at the beginning of the pandemic, did some caregiver surveys, and then also looked at the research that Break did about what caregivers needed, and built our COVID interventions around what we found, and we did over $200,000 worth of mini grants to several hundred caregivers across the state. That was definitely our most popular program. We did hundreds of caregiver care packages. We got lots of PPE out to caregivers. We were able to secure funding to get tablets and hotspots for our clients so that they could do some virtual caregiving, and a lot of other things. But we learned a lot from that. And there are programs that we would like to continue, such as our mini grants, and programs that we thought we would never do again because it was so challenging, like care packages. And then we got a call from our partner, the Tennessee Commission on Aging and Disabilities, who said, hey, we've got this supplemental funding. Do you want to do some PPE care packages? And so after having this big meeting where we said we're never doing care packages again because it was so much work, we were offered funding. And of course, you don't say no to any funding, even it's really hard. So can you switch? There we go. Okay, so this is what our PPE care packages, well, actually, so first of all, the care packages that we initially sent out across the state, they varied by funding source, but they were all like self-care sorts of things. So things like books by Brene Brown and bubble bath and tea and journals and all sorts of like just really great self-care stuff. But the money, the supplemental funding from Lifespan was just specifically for PPE care packages. And we had sent out a lot of PPE prior to the funding, the supplemental funding. But these were specific care packages. And so what we included were tablets, adult and youth face masks, thermometers, so like the really nice scan your forehead kind of thermometers, antibacterial hand wipes, antibacterial hand soap, disinfecting wipes, hand sanitizer, gloves. We got these COVID signs you can kind of see to the right side of the picture for folks to hang on their doors. Everyone got 3 of those. Children's books about the pandemic. You can kind of see that on the right bottom corner of that picture. And we also made, okay, the chat thing is in my way there. We made copies of the Providing and Receiving Respite Care Safely during the COVID-19 pandemic that Arch sent out. And so we made really nice copies of that on fancy glossy paper and spiral bound them and put plastic over them. So they were real nice. So that's what our care packages included. Can we go to the next slide, please? There we go. Okay. So with the supplemental funding, we sent out 94 care packages. It cost $384 per care packages. One of the lessons we learned when we did our hundreds of care packages prior was that driving around and delivering care packages was not a good use of staff time, just from a financial standpoint. And so that was one thing that we said we would never do again. And so for this round of care packages, we went with flat rate shipping. So we just got the large flat rate shipping box. So it's like $20 some a care package. And then it was all hands on deck. We have 5 staff, and that's my daughter in the picture there. Our kids all were required to help, not required, but we told our kids we needed help helping caregivers. And so our kids all came out as well. And so what we did was had all of the materials shipped to our office, and then as they came in, took them to we have a storage unit also where we store some stuff, and so took them to our storage unit, and you can kind of see that in the picture there, and just lined up 94 boxes on the ground and took each item and went down the line and stuffed the boxes. This again was one of the lessons we learned just from doing so many care packages last year. Was it was just easier to do this, you know, lining them out and going through box by box. And we just sort of worked together to fill everything and tape everything up. And then also found that the easiest way to ship them was to prepay for labels just on the computer, print those out, stick them on the boxes. And then we used several trips in a pickup truck and took them to my house and put them on the porch and scheduled pickup from the USPS. So all lessons that we learned for care packages. If you can go to the next slide, that would be great. So I just wanted to share some of the feedback. So we got really great feedback on all of the care packages that we had done throughout the year, but these PPE care packages were the last round of care packages that we had done. It had been quite a while since we had sent care packages. And so a lot of the feedback that we got from folks was, you know, it's really nice to get something again, you know, just to know that people are still thinking of us, because as caregivers, you know, I'm also a caregiver. I know a lot of you are as well. We're still struggling. And, you know, I think we did so much at the beginning of the pandemic, and as things started getting going again, we are still needing to support caregivers in new and different ways. So I was a little nervous that these care packages were going out too late in the game, but the feedback that we got was really great. So I'll just share a couple of these as well. I just wanted to thank you for the very thoughtful and unexpected care package. As a single mom of a son with autism, I felt seen and remembered during this COVID-19 season. You have no idea how much it meant. And then the second one here, thank you so much for my care package. I cried when I got it. As a single mom, no one has even asked how I was doing during this horrible time we are going through. I haven't received a gift for me in a long time, and I felt seen and loved. Thank you. And this was the feedback that we got regarding all of our care packages, was just like, hey, no one's even asking us how we're doing. I have felt so forgotten during this pandemic. And so, you know, something as little as sending some PPE can have a really huge impact. And so while we are hoping to never send out care packages again, just because of the amount of work, we are sort of thinking through, you know, what can we do that is similar to this, but a little bit easier. We did actually just do another round of care packages with one of our other grants, but we ordered pre-made care packages through Amazon and had Amazon ship them. So if anyone is thinking about doing care packages, I highly recommend going that route. It does take a little time to like type in every email or every physical address for your clients, but a lot easier than stuffing care packages yourself. So just wanted to kind of share the lessons we have learned from this process, and hope that that is helpful for folks. And I'm happy to answer any questions later that people have.
Thank you very much, Megan. And last but not least, Tina Urich from Illinois.
Hello, everyone. COVID-19 began like else. We were faced with the challenge of engaging a lifespan audience in a completely virtual medium. As a result of that challenge, the IRC pivoted our efforts in order to reflect and respond to what caregivers and individuals with disabilities wanted to interact with. Starting back in March of 2020, the IRC began to focus on efforts to social media and began segments to answer questions and provide resources. That was known as our quarantine questions. And we did a question a day that came to us across the state for 40 days. And then after that, our social media changed to navigating the new norm. We shifted our methods of reaching out from in-person visits to completely virtual outreach, creating and posting flyers on social media to be shared, creating an outreach email list of over 800 active contacts over the course on self-care segments, motivational posts, and free webinars. With that in mind, recently, we also partnered with the Respite Care Association of Wisconsin to bring their respite care certificate program to Illinois. Next slide, please. In order to curate our Facebook content, the IRC looked at our social media and website analytics to see what posts and content were garnering the most views and the most interactions. Looking at these analytics allowed us to curate our content consistently and expand the context we posted. One of the biggest impacts was with caregivers, as we all know. During COVID, caregiver burnout increased dramatically, and the IRC began posting motivational graphics. IRC also posted a virtual care package for caregivers across the lifespan. It included an inclusive workout, a playlist, Oprah's favorites, and motivational articles, and that's in the top corner there. And individuals could just simply click on the icon. We also expanded not only social media, but our website resources. Over 30 new resources were added to our website to take on more of a lifespan focus. Website views increased an average of 500 views per month, and important resources from our social media were added to the website and highlighted in email to ensure that we reached as many people as possible, regardless of their savviness or connectedness to social media. Next slide, please. Lastly, we strove to bring levity to our social media and online presence across the lifespan. Even though the pandemic created a whole new set of rules for people staying at home, we wanted to bring moments of happiness and positivity to an otherwise uncertain time. We created interactive segments available to anyone statewide to our social media that were not age exclusive. So on the bottom, you'll see Fall Rocks. Fall Rocks was a rock painting contest that we highlighted where individuals could paint a rock in a fall theme and picture of the rock to us. All winners got certificates, and we had 10 winners. And it gave our social media the chance to highlight the talents and creativity of the submissions. The other thing it did is it also introduced the IRC to future caregivers. We got a lot of, we didn't even know this, our neighbor could use your help. We also partnered with Fox Ridge Early Childhood Center in St. Charles, Illinois. And the children there, the early childhood special ed children, created handmade Valentines to caregivers. So we put out there, if you would like to receive a Valentine, we will mail it. So we have a picture there of little hands at work, and those were the early childhood children making the Valentines. Finally, we relied on creative and colorful outreach to continuously promote our statewide information and referral services across the lifespan, as well as our other county-specific services. Our outreach took creative and catchy slogans to continuously try to garner the attention of caregivers so we could put their loved one, regardless of age or disability, in contact with appropriate services. Our outreach ranged from hope for the holidays, don't sweat it, we have respite, you deserve a trusted break, and more. Our outreach has led to even more calls and emails, and we average about 400 per quarter. The majority of our calls result in referral to organizations in their area, but the IRC works with individuals until they are properly linked with an organization that can help them navigate services. This outreach has also helped us learn of other resources out there. And that's all I have.
Thank you very much, Tina. Appreciate that. Well, all, we are only a half an hour behind schedule. And I know by now many of you are probably really anxious to stand up, use the restroom, get some water. So I think we'll go ahead and take our break right now. If you have any questions for any of our presenters, please jot down their email and reach out to them after the event, or put the question in the chat. We do want to have time for our small group discussions on this afternoon. So let's go ahead and take, let's make the break. We'll still make it 15 minutes because I know everyone would like to move around. If you have time, we'd love to hear for you to post in the chat the ways that you get respite for yourself. Thank you all for posting your wonderful methods for getting respite for yourself. I plan to follow suit and copy some of your wonderful ideas for getting some respite. As I said, we're going to have the opportunity to break up into small groups. The topic for the breakout discussion groups today flow right from the remarks we heard this morning from Allison Barkov and from Lori about the future of respite. We'll all be asking you to consider this, taking into account how the pandemic has affected the way respite is delivered, as well as the ways in which the release of the Raise Family Caregiving National Strategy may be significantly increasing awareness about the growing respite needs of family caregivers, and therefore increasing our need to respond in meaningful ways. So not only do we have to think about maybe how the definition of respite has changed moving forward, but how it's coming at the same time that the need is going to be escalating. And so how are we going to rise to the occasion to meet those needs? In these last 15 minutes, we just want to hear back from you all about the major points that you were made in the group, and we can keep that pretty brief. And then I will give some instructions about tomorrow's meeting as well. So why don't we start with group one? I think that was Cassandra. Do you have some points you'd like to report back?
I have a number of points, and I'm wondering if Tracy, who was our phenomenal note taker, would like to highlight a few of them. I will say that there was a lot of discussion about some of the wonderful things that happened during COVID that people do not want to lose track of. Nick talked about flexible vouchers that they used. They really changed the way they did use vouchers, and it was successful, and they want to keep doing it. Also, training and stipends that were available for people who receive training. These are a few things that would like to be continued. Tracy, would you like to share a few more? Because I know our time's limited, but maybe one or two key points on funding, maybe?
Sure. So we talked quite a bit about wanting to have funding across the state in different ways. I know that there's lots of levers that are allowing some fantastic funding, and we're super grateful for that. And the same token, there's a lot of great ideas in wanting to have it, representative through all the states in the US territories. So there was a dialogue on a congressional line item for funding for respite. There was great creative things that we were doing in COVID that the colleagues in our circle were talking about, which is uptake of support care, the care packages, 800 numbers, resources, all those great, fabulous things that people are doing, including posting information about respite in gas stations. So a lot of really cool things that people are doing to do the awareness. But obviously we all know technology is a big game player in this. And then we shared the resource we're using in Washington State in collaboration with our TBI Council, which is the heypeers.com platform that offers us the start of our statewide caregiver support group. With that.
Wonderful. Anything else from your group?
So if anyone from our group wants to speak up now, you'll see Tracy's notes. They're phenomenal. So
I already promised everyone that we would write up, get our notes and write them up and share them in addition to the recordings of the sessions as well.
And send them to Lori.
And send them to Lori and to all of you. Okay, second group. Susan, do you want to go next?
Sure, I'll go next. And Cheryl Donnell helped with notes, and we had an excellent discussion. We spent a lot of time talking about the RAISE recommendation and the components of that, the high quality, setting appropriate caregiver defined respite. And the discussion started out by both Cheryl from Nevada and Dina from New York talking about the work they'd already done, hearing from caregivers, a self-directed pilot program in Nevada, and the work that New York has been doing, launching a work group, partnering with a coalition to expand the models that they're using. And that was guided by focus groups with caregivers that gave them really rich data. So in both of these programs going forward is being guided by the data that they've collected. So it's really thoughtful, it's really strategic. One of the things that came up in that discussion, which I think is really important, is that how you define the terms, high quality, setting appropriate, caregiver defined. And we discussed about, Cheryl introduced the notion of a good enough measure according to parents. So not just quality imposed from the outside, but professionals, but when a caregiver feels confident and trusting in the care they're providing, and how that's tied to the caregiver definition of respite services. So we talked about that. Roslyn from Washington State brought up the issue of behavioral challenges and appropriate settings and availability of services. And we got into a really rich conversation about understanding those and meeting those and not overlooking those in respite, which we tend to do. Cheryl gave a great example of how communication issues can be conflated with behavioral issues, and that, again, that we need to hear from caregivers to help us understand what's going on with their care recipients. Then moving on to COVID, a great discussion about emergencies and preparation for emergencies, that COVID is ongoing, but it's not the only emergency our families experience. Families may experience an acute emergency. They often have slow rolling kind of routine chronic emergencies, and that in terms of respite services, we don't pay enough attention to those. And helping families, part of helping families have informal supports is having a backup plan, no matter what the situation is. And then we talked a lot about, we kind of revisited the wonderful information we got from Bring, Brag, and Borrow about the supports that have been offered during COVID. Especially we talked about Alabama and Tennessee supports. And then Carrie from Montana talked about some really low key pragmatic supports. They used robotic pets, weighted blankets, some things that were really helped with in rural areas where there was a shortage of workforce. And then the last thing we talked about that was really interesting was the use of technology on a phone app or a camera that allows you to monitor a care recipient, so you can get just a short time away as a caregiver to walk around the block, to work in your garden, and to have people in your family or friends just do like the 15-minute monitoring to allow you just to get a little bit break. So in that continuum of options for respite, that came up as something that needs more exploration. Okay, Cheryl, did I do okay? Anybody else in the group? Did I get it? The main things?
Sounds good to me.
Okay, thanks so much for your help with that.
Great, that you guys accomplished a lot, discussed a lot of issues.
That's just the tip of the iceberg.
Ray, you want to summarize your group?
Sure. Thanks. Just very quickly, Marcia, I was not quick enough on the trigger to stop my recording. So if it didn't do it automatically, you might want to do that right now for me because I can't get back in there to do it. Yeah, we tended to focus our conversations around the impact of COVID on respite, reactions to that, and then ideas going forward as hopefully the pandemic permits. And there were several themes that seem to emerge. First of all, in thinking about traditional respite as involving some form of face-to-face service provision, whether it's an in-home care or respite service or camp, whatever it might be, workshop. The COVID caused a lot, if not most, of that face-to-face, particularly in the beginning, to be stopped. And so the reactions to that have tended towards virtual substitutes. And there seems to be now a call from caregivers to return to some form of face-to-face service provision as the pandemic permits. However, a lot of the things that were offered both earlier in the conversation today and then in the breakout were attempts to at least provide some form of personal contact, if not face-to-face, such as the care packages that seem to be very well received and or at least some form of a substitute for that. The things that seem to affect the provision of services virtually focused on technology access. Many folks can't do that. If you have a statewide virtual conference, theoretically that would allow many more people to attend because it does away with travel, but it brings with it some baggage in that just because you're not traveling doesn't mean you can stop caregiving during the allotted time of a virtual conference. They can be recorded so people can watch them later. So again, there are pluses and minuses to these alternatives. And I think it was Nancy Rinelli suggested that maybe some hybrid models where if the longer we have to keep going with some kind of virtual meetings and conferences at state levels, that there could be some in-person attendees, but the events could be live streamed and recorded. So I thought those are some pretty interesting issues. But those issues of cultural reluctance to participate in the technology, and then accessing rural participants in respite were quite real. I think the people agreed that about 50% of people who signed up for a virtual conference actually attended. So there's some issues there that we're missing. A very interesting comment I thought from Patrick about as we move forward is rekindling working relationships with other state programs to get respite back in the mainstream of conversation, to resurface its credibility where it hasn't been as available to agencies that might have worked with us in the past or made referrals in the past. I thought that was a pretty important one. So vouchers as well, and that this will be my last comment, that changing the vouchers, increasing the time available, increasing the amount of money available, and making adjustments to who could be the recipient of the voucher payment made them viable or brought them back as a viable option during COVID. So, and I will write these up. I have only myself to blame for for not getting a note taker. So,
Anybody else from that group have anything they want to add? Well, our group was incredibly productive and had so many wonderful ideas as well. We started off talking about how, as grantees, we might be able to help implement the RAISE recommendations around respite. We talked about public and private responses to that, and we wound up spending a little bit of time on Kathy Mayfield Smith, especially from South Carolina, talking about their work with the faith community to try to increase respite options and natural supports for families outside of the formal service system. And what they're learning is that when it all falls to the faith community, it's a little bit tricky because it tends to fall on just one or two people. And so what they're beginning to explore is how do you build more community partnerships with the faith community, partnering a church with a teen center or a recreation program, and building those community-based partnerships that can provide similar supports, but it doesn't fall just on one agency to be the respite provider. We found that to be a very interesting option. And we did talk about, though, these special needs, especially in rural areas. How do we provide natural supports for family caregivers in rural areas where the faith community might be the only option there? So that still remains an area that needs to be explored more fully, is how do we address the respite needs in rural communities. But we also talked about what employers can do to help increase access to respite opportunities. And we agreed that COVID really helped raise awareness about caregiver needs with employers. And while a lot of the ways that they're responding have to do more with workplace flexibilities, there may be other things that employers can do. And we really thought that the Alabama Wellness Initiative, the mental health thing, was something that employers could do. It's such a wonderful model, and why shouldn't we get employers, since they have increased awareness about family caregiver mental health needs? Maybe that would be a great thing that grantees could work with employers in pushing a model like that. We also talked about no matter what changes we make and no matter what respite opportunities we have out there, especially Alicia raised this issue in North Carolina, that there's a tremendous lack of providers. So even when families have the dollars to pay for respite, they can't find the people to provide the care. And this remains an ongoing and critical issue, again, especially in rural areas where providers are even more limited. I've forgotten, I think it was Tracy in Alabama who talked about an initiative they're doing around direct workforce that they hope to do with their new Lifespan grant, is to award stipends to potential providers to take an online training, and then they'll start collecting some data. And very similar to what we're doing with NASHB and the Respite Care Association of Wisconsin to develop the training around core competencies, but not just for respite care providers, across the direct service workforce, and really trying to build up providers that way. Alicia mentioned that she heard about an app where PA, I don't know if it was students or PA providers, physician assistant providers or students, that someone in the private sector was developing an app where you could find a respite provider from a network of physician's assistants. I thought that was an interesting, kind of the way that we get an Uber or we get groceries delivered, there's an app where you go online and can find a physician's assistant to provide respite. So we continue to be reliant on technology to help us advance in the provider crisis as well. We spent a lot of time, I was really interested in what grantees had done, the changes they made to their programs during COVID that they plan to keep. And I was delighted that all the grantees who talked about the changes they made to their respite voucher program, similar to what Ray was just talking about, increasing the amount of the voucher, increasing flexibility and who could provide respite, that they will continue to keep those changes in place. They don't have any intention of making changes. Programs like Montana that, and I think Susan talked about this earlier, that have extreme flexibility in the types of supports they can provide to caregivers, the weighted blankets, chair cushions, delivering of groceries, they're going to continue to offer that extended support as well. as well as the reassurance calls, the online support groups. Colorado is going to continue to provide that as well. Some of the lessons that we learned from the pandemic, and there was a lot of agreement around this, is that just throwing money at the problem is not necessarily going to help the situation. I mean, we're very grateful for the additional dollars, but if there isn't that infrastructure at the state level to process the dollars and get the money out the door, it really becomes a very difficult and impossible situation. And so there's still waiting lists for services. There just isn't the infrastructure in place to get it all done. There was also, some people have seen a lot of hesitancy on the part of their providers to accept temporary dollars and start providing services because they don't want to be able, they don't want to tell family caregivers 6 months or a year from now, sorry, now we're out of money. So they'd rather not start the service to begin with. So they've seen a lot of hesitancy around those short-term supplemental COVID dollars. And of course, the whole issue of infrastructure is even worse in rural areas in terms of the provider network or getting the dollars out the door. I think I mentioned everything. My group, did I forget anything important? So much good information, so much expertise in my group. Thank you so much. Anybody have anything to add to any of those groups or comments on anything you heard? And again, we promised to write it up and make this all available to you because the conversations were really rich and helpful. So thank you all. Well, in the interest of time, we're already after 4 o'clock. And fortunately, we don't have to say goodbye right now because we're all going to meet again tomorrow. It may say 12 o'clock on your Google Calendar or your Outlook calendar, but we're not getting started till 12:30. So no need to check in until 12:30. We have very much the same structure tomorrow. I'll start off with a quick ARCH update just for those of you who may be new to the group and want to hear a little bit about some new products and some new initiatives that we're undertaking. And then we'll move into the bring, brag, and borrow session again. And hopefully tomorrow, if everyone can stick to their 5 minutes, you all had such wonderful information today. I did not want to cut any of you off because what you were saying was so incredible and I didn't want people to miss that. But please, if it's possible, we'd really appreciate it if you could keep your presentations to 5 minutes. And then we're so lucky, we have a guest speaker in the afternoon who's really going to kick off what I hope will be some more work that ARCH is going to do in talking about reaching culturally diverse populations as we move forward with Respite. We're fortunate to have Dr. Lauren Parker from Johns Hopkins, who's also working on the new public health center on dementia caregiving at the University of Minnesota. She's doing a lot of the work there on cultural adaptations to adult day services. So she's going to be talking with us in the afternoon and then joining our small breakout groups in the afternoon where we can all explore how we can move forward around reaching diverse populations. I was very excited too to see that there are 2 or 3 of our states that are actually going to be talking about that tomorrow and bring, brag, and borrow the specific work that they're doing to reach diverse populations. So it all is going to flow together very well. And we'll look forward to seeing you all back. I will send out the link again, so you'll all have it in your email and no one has to email me and say, I don't have the link. You'll all have it in your inbox in the morning. And if there's anything else that you need from me before then, please let me know. Lori, did you have any last minute comments or questions for anybody?
Oh, no, it was a great day. Thank you. Really enjoyed everything and everybody in the small group. What fun. What fun.
So much great information today. Thank you again, everybody, for staying for the full 3.5 hours today. And we'll see you back here again tomorrow.